Hello everyone, my name is Shrai Harrington and today I will be presenting about Bordetella pertussis and whooping cough. These will be the topics covered in this presentation. I will start off with discussing the causative agents of whooping cough, then move into the epidemiology of the disease. Then I will discuss its virulence and its etiology and transmission, and then I will conclude the presentation with the prevention and treatment of whooping cough. So what is whooping cough? Whooping cough, which is also called pertussis, is a very contagious disease that affects the upper respiratory system. It is caused by the bacteria Bordetella pertussis or B. pertussis, and it is only found in humans. The morphology of B. pertussis can be rod-shaped, coccoid, ovoid, and it is arranged in singles. B. pertussis is a gram-negative bacteria, which means it will stain red on a gram staining. It has capsules, which is shown here on the top right, and it does not produce endospores. B. pertussis also has circular chromosomes and double-stranded DNA, and one interesting fact about its metabolic properties is that it is an obligate aerobe, which means that it needs oxygen to grow and survive, and it uses the amino acid glutamate for energy, which makes it a chemoheterotroph. And then the size of the bacteria ranges from 0.8 micrograms by 0.4 micrograms. Okay, moving on to the epidemiology of whooping cough, we can see here on the graph to the left the pertussis incidence per 100,000 people by age group in the United States from the year 1990 to the year 2021. And the thing that sticks out most from this graph is that infants, which is highlighted here in green, so infants less than 1 year old continue to have the highest reported rate of pertussis. Here, the graph on the left illustrates the number of pertussis cases reported to the CDC, which is the Center for Disease Control, from 1922 to 2021. So before the pertussis vaccine was introduced in the 40s, the cases exceeded 100,000 per year, but then they soon began to decline after the widespread use of the vaccine in the United States. And the most recent data says that in 2021, there were 2,116 cases of pertussis that were reported to the CDC. So as seen in the last slide, young infants continue to have the highest risk of contracting pertussis as they have a developing and a weaker immune system. It's also a note that developing countries or countries that do not have widespread availability of vaccines are most susceptible to having higher cases of pertussis. And here we can see on the right that in 2019, China had the highest number of pertussis cases globally. The incidence of pertussis has decreased since the pertussis vaccine became available in the 1940s. And then another relevant fact is that people who have pertussis, especially in vulnerable populations, whether that be young infants or older adults, tend to develop secondary bacterial pneumonia, which can lead to death. So a little bit about the virulence of B. pertussis. So once a bacteria enters your body, it produces 3 types of toxins, which includes the pertussis toxin, the adenylate cyclase toxin, and the tracheal toxin. So starting off with the pertussis toxin, this causes toxicity throughout the body by having an indirect inhibitory effect in adenylocyclase and the GPCR pathways, so G protein pathways. This is done by ribosylation of the GI protein, which will cause an accumulation of cyclic AMP in the cell, which leads to increased mucus secretions in the upper respiratory tract. And then I've included a picture here on the bottom just to explain that pathway a little bit better. So in addition to the pertussis toxin, it inhibits chemokine receptors. So in other words, white blood cells or lymphocytes do not go to the site of infection and they accumulate in the blood. The adenylate cyclase toxin also increases cyclic AMP in the cells and increases mucus secretions in the upper airways. Then lastly, the tracheal cytotoxin actually forms part of the peptidoglycan wall of the bacteria B. pertussis and inhibits the looping of cilia. This will interfere with the clearing of pulmonary secretions. And then the picture I included for this slide on the top right shows how the bacteria attaches to the cilia in the upper airways via a protein called the filamentous hemagglutinin. And that's shown here. So here's a bacteria, and you can see it attaching to the cilia. So moving on to the etiology and transmission of the disease. So the reservoir of B. pertussis is only found in humans. So to this day, we know that animals, any type of mammals, insects, they are not hosts for this bacteria. The bacteria is passed between humans via airborne droplets, either through coughing or sneezing, and this disease is located in the upper airways, which include the mouth, the nose, and the throat. So after 1 to 2 weeks of being infected with the bacteria, a patient will typically present with a runny nose, which is also called rhinorrhea, a low-grade fever, a mild cough that comes and goes, and apnea and/or cyanosis, which is a cessation of breathing and a bluish tinting of the skin due to the lack of oxygen. And those last two symptoms are most commonly found in young children, just because their lungs are smaller and it takes a long time for their oxygen to circulate through their bodies. So 1 to 2 weeks after the initial symptoms present, a patient will have rapid high-pitched coughing, which sounds like a whoop when they breathe in. So that's where the name whooping cough comes from, because of the whoop-like sound on the cough. And some patients will also have post-tussive emesis, which is vomiting after coughing due to the force of the action of coughing. Sadly, there are complications to getting pertussis. Some of these include 2 out of 3 children under 1 year old will develop apnea, about 20% will have pneumonia, 1 in 50 people will have convulsions or seizure-like activity, 1 in 150 people will have swelling of the brain, and sadly, 1 in 100 people, or 1% of children under 1 year old, will die. On the contrary, teens and adults will present with severe coughing, which might lead to syncope or fainting, fracture of the ribs, a little bit of urinary incontinence, which is urination due to the force of the action of coughing, and lastly, weight loss, which can be secondary to loss of appetite. The good thing about this disease is there are vaccines that can prevent serious illness. So DTaP is given to children. This vaccine includes vaccination against pertussis in addition to diphtheria and tetanus. So there's kind of a schedule when these vaccines are given. So DTaP is given to children 2, 4, and 6 months of age, and then again through 15 through 18 months, and then another vaccine will be given between the ages of 4 and 6. Tdap is given to adolescents and adults. So for Tdap, when you're in your preteens, you can get it once, when you're 11 or 12, and then again for women who become pregnant, they are given Tdap during the 27th through 36th week of pregnancy for each pregnancy. And then Tdap is also given to adults anytime for those who have never received the vaccine. Other preventative measures include hand washing, so washing your hands for at least 20 seconds with soap and water, covering your mouth and nose when coughing or sneezing, whether that be coughing into your elbow if you don't have a tissue, or coughing and or sneezing into a tissue, and then throwing away that tissue and then washing your hands afterwards. Another common thing is using a alcohol-based hand sanitizer to prevent getting pertussis. Some of the treatment options for this disease often includes taking antibiotics, most notably azithromycin, which acts to inhibit protein synthesis of the bacteria. And again, other treatment measures like any common cold include drinking plenty of fluids to prevent dehydration, washing your hands frequently with soap and water for at least 20 seconds, and then again, eating small meals to prevent that post-tussive emesis, which is vomiting after coughing. So thank you for listening to my presentation. I've included a slide of the work cited on this slide and then the next slide. But yeah, thank you for watching and listening.